the Netherlands, every year 1,300 families are left empty-handed after the death of their baby. It is extremely sad that this has happened to you. We understand that you want to find out the cause. In this video, we explain clearly and concisely what options are available for having your baby examined. In many cases, a cause can be found for the death of a baby. The most common reason is a problem during pregnancy or childbirth. For example, the position of the baby or problems with the placenta. Other causes may include abnormalities in the placenta, a hereditary abnormality, or an infection. Sometimes the reason is immediately clear. For example, when an infection is found or if the placenta detaches. This is often visible on the outside. If the cause is not immediately known, your baby can be examined further. There are different types of examinations. Each examination looks at the body in a different way and can reveal different things. The mother's blood, urine, and a smear test can be examined. This can show whether there was an infection or virus that reached the baby via the placenta. The doctor will always examine your baby externally. He will look for anything that could indicate a congenital abnormality. Depending on what the doctor sees, he will discuss whether further examination is necessary. X-rays can be used to examine your baby's skeleton. This can provide information about growth and possible abnormalities. Your baby does not need to be opened up for this examination. Pictures are taken of the front and side of the body. Sometimes abnormalities of the bones can be seen on the picture. An MRI scan allows organs, muscles, and the nervous system to be examined in detail. This examination does not require the baby to be opened up. It leaves no scars or damage. A biopsy involves removing a small piece of tissue from your baby, usually from a place that is almost invisible. This small piece of tissue can be examined to determine whether there is a hereditary abnormality. This examination is often complementary to, for example, amniocentesis or chorionic villus sampling. During an autopsy, the pathologist opens your baby to examine whether all organs are properly formed and in the right place. Small pieces of tissue are examined under a microscope. This can provide more clarity about the cause of death. An autopsy always requires the parent's consent and all organs are replaced after the procedure. The autopsy is performed by a pathologist in the mortuary. This is often in the hospital where your baby died, but sometimes your baby will be transferred to another hospital. The examination will take several hours. Your baby will be returned to you looking as beautiful as possible. All stitches will be covered and will no longer be visible. Unfortunately, the scars will still be noticeable even when covered by clothing, so do not be alarmed by this. Sometimes a separate examination of the brain is carried out. This can reveal whether there was bleeding or oxygen deprivation. You must give separate consent for this examination. The brain is removed from the body and can never be returned to the body. Once the entire examination is complete after a few weeks, the brain can be returned, for example, for burial. In many cases, your baby's head is filled with the same weight as the brain. The placenta plays an important role in your baby's growth and health. Sometimes the placenta does not function properly. This can cause your baby to receive too little oxygen or nutrition. This can be a cause of death. Examination of the placenta often provides important information. If a baby dies unexpectedly at the end of a pregnancy, the cause can be found in the placenta in 55 to 80% of cases. If the cause of death remains unknown, specialist placenta pathologists may still be able to identify a cause by conducting further research on the placenta. You can ask your gynecologist or paediatrician to send tissue for further research to these perinatal pathologists or email them to request an examination.